Many people do not think of bits of food and, stuck in between their teeth after eating a delicious sandwich, or the consequences of not brushing and flossing your teeth on a regular basis. Today I would like to introduce to you why taking care of your teeth and visiting the dentist on a regular basis is important. The minimum requirement for visiting the dentist, according to Colgate.com, is at least twice a year. And that's if you're not experiencing any toothache or any oral problems. Visiting the dentist for regular checkups and cleanups is a very important factor in maintaining good dental health. Not many people visit the dentist as often as they should. And what many people forget is that you can also catch very serious diseases if not taking care of your teeth the proper way and not flossing and brushing them regularly. Tooth decay, also known as cavities, are very common in today's society. Cavities are caused when plaque combines with the sugars and starches that are in foods. Both of these combinations Cavities are caused when plaque combines with the sugars and starches that are found in food. Both of these combinations attack the tooth enamel. In order to help prevent cavities from forming, it is important to at least brush your teeth twice a day and floss on a daily basis. Also, regular checkups can prevent cavities, root canals, gum disease, oral cancer, and other dental conditions. I actually learned the hard way. I hadn't visited the dentist for about a year or more, and when I went back, I had a total of 8 cavities, and I had to have the entire procedure done on that day. They had to split it up into 2 days. I had 4 done on one day and 4 done on the other day, or 4 done 2 days after. I learned my lesson through that. It's very painful. I hate the dentist so much, but now I go regularly, or when I'm supposed to go, before I actually feel a cavity forming, which is when I drink a soda or I eat something sweet, I start to experience this pain in my tooth, and it's like, oh, I have a cavity, which is terrible. According to dentistry.com, Sean Watson states, often taken for granted, the monotonous task of brushing and flossing our teeth daily has never been more important. In order to avoid gum disease and the risks gum disease plays on our overall health, it has been estimated that 75% of Americans have some form of gum disease, which has been linked to serious health complications and cause various dental problems that are often avoidable. Gum disease is one of the main causes of tooth loss in adults and has also been linked with heart disease and strokes. According to WebMD.com, gingivitis, also known as gum disease or periodontal disease, begins with bacterial growth in your mouth and may end if not properly treated with tooth loss due to destruction of the tissue that surrounds your teeth. If diagnosed early, this disease can be treated and reversed, but you have to be the one to initiate the process. Also with this, when I was younger, when I was about 2 years old, or 3, I suffered from the baby bottle syndrome. And what it is if you let your baby fall asleep with the bottle when they're sleeping and they're drinking the milk, their teeth will decay. So that happened to me. My front teeth decayed, and I needed to have a bridge put on. But then later on, when I was about 5 or 6, I was playing around on the playground, and I fell. And I fell obviously on my face, and my bridge went into my gums, and I started to bleed, and I had to go to the dentist and have that removed. But they offered to put another bridge in. They said, oh no. I said that I didn't want it anymore. So what the dentist said was, well, her teeth are going to be very when she grows up, her adult teeth grow in, they're going to end up very crooked. And she'll then have to get braces, which is exactly what happened. Many people experience bad breath, either when you wake up in the morning or throughout the day. Dentistry.com says that 85% of people with persistent bad breath have a dental condition that is to blame. If bad breath is the cause of a dental condition, mouthwash will only mask the odor and not cure it. Proper nutrition is very important in maintaining good dental health as well. WebMD.com states sugars that are found in soft drinks and non-nutritional foods combined with bacteria that is found in our mouths produces acids that attack tooth enamel, which can also lead to cavities and gum disease. Limiting the intake of soft drinks and foods that are high in sugar can greatly help to maintain good dental health. If your dentist gives you a treatment plan for dental work that you need to have done, you should focus on getting your teeth fixed as soon as possible and not wait till the last minute to suddenly realize that you may have a serious problem on your hands. Even a small cavity can make a huge impact on your teeth if not taken care of, because Dentistry.com informs that cavities continue to get bigger, and if they get big enough to reach the nerve in your tooth, your only option would be to have a root canal, which is a treatment used to repair and save a tooth that is badly decayed or becomes infected. I've described for you the many effects that can be caused due to bad dental health and the precautionary steps that can be taken in order to promote good dental health. I hope that this information was helpful, and all of you visit the dentist on a regular basis.
Alonzo, what did you think?
I thought the opening hook was a little short and probably could have been a little better to get our attention. The thesis was clearly stated. We figured out what she was going to talk about. Throughout the speech, there was a lot more reading than speaking going on. She looked down a lot at the paper. She didn't even move around that much. The best part of the speech, though, was when she was giving the personal stories.
Yeah.
Because that's when she started to look up at us, and she was doing more speaking to us than just reading off a paper to us. Yeah.
Okay. Well, nice demonstration of good listening skills. I've taught you well because you picked out a couple of things that obviously everybody is noticing, and you voiced them pretty effectively. When you look up and tell us the stories, that's when you're at your best when it comes to the delivery. But otherwise, there's a lot of reading that's going on, and I think he's right that you stand in the one spot the whole time. You're not really adjusting to the audience. You don't step forward. It's almost as if you're not quite sitting on the chair, but I tell you what, you're backed up as far as you can get with that furniture behind you. You know what? We're not going to bite. Step up. Approach the audience a little bit. Change the orientation of your body sometimes, because even when you do look up, it tends to be toward the center part of the audience. And don't forget the folks on the edges over here. They need to be engaged too. I like when you do that, and I think when you tell the personal stories that's when you're at the best when it comes to presentation. Now, there are a lot of good things in the presentation that I think you ought to get credit for. There's a lot of research in the speech. I think you did a good job finding information on all of the individual points to make it relevant and to prove your point. I think that's good. I think you needed a little bit more structure. As I look back at it, I can kind of impose a structure on the problems. We're talking about cavities, we're talking about gum disease, we're talking about bad breath. I'm having to do that. I didn't really hear a preview at the beginning of the speech that talks about what the structure of the speech is going to be. Now, it's not a complicated topic, So ultimately it comes down to, look, take care of your oral health, but you want to make sure that you give us those suggestions, not just in the body of the speech, but kind of a recap at the end too. And I think that that would help. I thought that your recap actually structured the speech more than you had done at the beginning or during the speech, but you also need to do those things about the suggestions. So for instance, you ought to be flossing every day. You ought to be brushing twice a day. If you use a mouthwash, that's fine, but you know what? That's not going to substitute for taking care of those other problems. And if you're not seeing your dentist twice a year, that's not enough, that kind of thing. So just kind of re-emphasize those particular points. They're okay to make. You said them during the speech. I'm just telling you, you need to punch that one more time at the end of the speech, because that's really your suggestion. And then I think you've got a few places where you've got negative visualizations in there where you're talking about your personal experience. I think that works pretty well. It might be a good idea to have some positive visualization too. For example, you said, I hate that problem. I don't want to have that sort of thing again. Well, talk about your experience. Now when I go to the dentist every 6 months, because I'm careful about brushing my teeth and because I floss, I hardly ever have a problem. Maybe there's a little bit of a cavity issue, but you know what? I don't wait till the end of the 6 months to go and take care of that. I do that now, and instead of having to get a filling, he's able to address the decay some way. And I haven't had to have a root canal since I was 12 years old, or whatever it is. I mean, something like that. I'm just extra things to make it work a little bit better. All right. Merci.